Everyone, and welcome to this deep dive. It's all about geriatric assessment.
Oh, this is going to be good.
It is, right? And for this one, we're focusing on the Orlev Center's geriatric care team.
Oh.
They've got some amazing insights.
They do, don't they?
So let's just dive in and imagine you're a medical professional. Or maybe you've got a loved one who's aging, right? Mm-hmm. And you want to make sure they're getting the absolute best care possible. But where do you even start with understanding what a thorough geriatric assessment really looks like?
That's such a good question.
It is. It is. So that's what we're going to get into today.
Awesome.
By the end of this deep dive, you'll have a much clearer picture of why these assessments are so crucial and all the key areas they really should cover. You know, when we were looking at the material from Orlev, the team there really emphasizes the importance of like that super detailed physical exam. It's like the bedrock of a geriatric assessment.
It is. It's like the foundation.
Okay, that makes sense. But for our listeners out there, why is a physical exam so important, specifically when we're talking about older adults?
You see, many older adults maybe aren't able to fully communicate all of their health issues.
Oh, interesting.
It might be vision problems, maybe some cognitive decline, or, even other factors.
Yeah.
That thorough physical exam, it helps bridge that communication gap for us.
I see.
It uncovers those potential problems that they might not even realize they have.
So it's like we're putting together a puzzle, but we need all the pieces.
Exactly.
And so help me out here. When we talk about a physical exam in this context of geriatric assessment, what are we really talking about? What does that look like?
We're talking about checking those essentials. Blood pressure, weight, BMI.
The basics.
Yeah. We're looking for signs of any underlying health issues.
Okay.
And then we tailor that exam based on the individual's specific symptoms and conditions.
There's like personalized medicine, but from the very beginning.
Exactly. It's about getting that complete picture of their health.
Now, I know vision and hearing are something that we all kind of think about when we think about getting older.
Yeah.
But why is there that extra emphasis on it in a geriatric assessment?
Because often these changes go unnoticed by the individual.
Really?
Yeah, think about it for a second. Someone who's struggling to read their medication labels, but they don't even realize that their vision's deteriorated.
Wow, that could be dangerous.
Right. Or they might stop going to social events because they just can't hear the conversation.
And that can have a huge impact on their mental well-being, too.
Exactly. And there are simple ways to assess these things, like we ask about driving difficulties, we use a Snellen chart for vision, or the whispered voice test for hearing.
Those are the classic tests, right?
They are, and they're powerful.
Okay, let's switch gears for a second and talk about nutrition.
Okay.
So what kind of red flags would you say poor nutrition could be signaling in older adults?
Poor nutrition can be a sign of a whole range of problems. Medical conditions, depression. It could be difficulty shopping or cooking.
So many things.
Financial constraints even. It's a really multifaceted issue.
And I remember the Orlev Center team really focused on unexplained weight loss as a major red flag.
Oh, absolutely. That is something we can't ignore.
And they actually give a specific threshold for us, right?
Yeah. If there's a 25% weight loss over 6 months or a BMI below 20, that requires a much deeper investigation.
Makes sense. Now, let's talk about something that I know is so common in older adults, taking multiple medications.
Oh, yeah.
Which is where polypharmacy comes in.
Exactly. Polypharmacy, using multiple medications, super common in seniors.
Right.
But it can lead to new symptoms that mimic other conditions.
Oh, wow.
Or even make existing treatments less effective.
It's like a domino effect.
It is. It's like this tangled web of medications, and it's crucial to understand that individual's full medication list to make sure they're getting the best care.
So it's about really getting the whole picture.
Absolutely. And it's not just knowing what medications they're taking.
It's more than that.
It is. We need to understand why someone might not be taking their medications as prescribed.
Oh, interesting.
Is it financial? Are they afraid of side effects? Maybe they simply don't understand the instructions.
So many factors.
These are crucial questions.
So it's about seeing the whole picture, not just the symptoms, but the reasons behind them.
Exactly.
Now, let's shift gears to something that I know can be sensitive, but is incredibly important to address cognitive function.
Yes, this is a big one.
It's a crucial aspect of geriatric assessment, right?
It is, and the statistics are striking. The source material actually tells us that the prevalence of dementia doubles every 5 years after age 65.
Wow, that's a scary thought.
It is, and it highlights why assessing cognitive function proactively is just so important.
Because you can't always tell.
Many patients don't volunteer concerns about their memory or thinking.
Right.
We have to be proactive.
And it's not just about dementia, right? Even mild cognitive impairment can have a big impact.
Absolutely. It raises the risk of accidents, delirium, and even medication non-adherence.
So many.
It's important to catch these issues early.
And how do we actually go about assessing cognitive function? Because we want to make sure it's sensitive and accurate, right?
Right. Well, there are a number of tools that are commonly used, and we'll get into the specifics of those in a bit.
Okay.
But the key is to approach this assessment with empathy and understanding.
Yeah.
We want to create a safe space for the individual.
That makes sense.
Yeah, for them to share their experiences.
It's not just about the test. It's about the person.
Absolutely.
Okay, so let's talk tools. I know one that we hear about a lot is the mini mental state exam, the MMSE.
Right.
What are some of the other tools that are used in cognitive assessment?
Yeah. So there's the Montreal Cognitive Assessment, or the MUCA, and then there's the St. Louis University Mental Status, or SOUMES exam.
Okay, so a lot of options there.
There are, and before we get into those specific tests, it's important to understand what they're actually measuring.
Like, what areas of cognition are they looking at?
Exactly.
I'm ready. Let's get into it.
All right. So these tools, they assess a variety of those cognitive domains.
Okay.
We're talking memory, attention, language, visuospatial skills, and executive function.
Okay. Break that down for me. What do those domains actually look like in practice?
All right. Well, let's take memory, for example.
Yeah.
We might ask the patient to recall a list of words, maybe remember a short story.
Oh, okay.
And when we're assessing attention, we might have them count backward from 100 by sevens.
Oh, that's a classic.
It is. Or identify specific letters within a string of characters.
So it's not just about like asking random trivia questions.
Yeah, no.
It's about actually evaluating how well someone can perform these tasks.
Exactly, precisely.
That require those different cognitive skills.
Yeah, then there's language assessment. We might ask the patient to name common objects, repeat phrases, or follow simple instructions.
Okay.
And then visuospatial skills, that's how we perceive and interact with the world around us.
Right, right.
So tasks to assess those skills might involve copying a geometric figure, drawing a clock face, or navigating a simple maze. These tasks give us insights into how the brain processes that spatial information.
That's fascinating, how these simple activities can actually tell us so much.
It is.
What about executive function?
Executive function. Oh, that's a big one.
It sounds important.
It is. It's essentially the brain's control center.
Mm-hmm.
It governs those higher level processes like planning, problem solving, decision making, and inhibiting those impulsive behaviors.
So how do these cognitive assessments evaluate executive function then?
We might ask the patient to explain similarities between objects, maybe solve a simple puzzle, or even perform a series of actions in a specific sequence.
Oh.
These tasks require the person to plan, organize their thoughts, and control their responses.
So we're seeing how their brain works.
We are.
Now, I know you mentioned that a patient's education and literacy levels are important to consider when we're looking at those results.
Yes, definitely.
Of those cognitive assessments. Why is that?
It's crucial to remember that those scores can be influenced by things like education, cultural background, and language proficiency.
Oh, of course.
Someone with limited formal education might score lower on certain tests, not because of cognitive impairment,
I see.
but because of a lack of exposure to certain concepts or vocabulary.
That makes sense. We need to be mindful of that context.
Absolutely. Interpret these scores within the context of the individual's life experiences.
Right.
It's a reminder that these assessments are tools to guide us.
Not a diagnosis.
Exactly.
Now, let's go back to mental health assessments for a minute.
Okay.
We talked about screening for depression and anxiety in older adults.
Yes.
Using those tools like the PHQ-2 and the Geriatric Depression Scale, or GDS.
Right.
Can you walk me through this a bit more?
Okay, so the PHQ-2, that's a quick and easy screening tool for depression.
Okay.
Just 2 questions.
Which is okay.
Over the past 2 weeks, how often have you been bothered by little interest or pleasure in doing things?
Right.
And over the past 2 weeks, how often have you been bothered by feeling down, depressed, or hopeless?
I see. So it's pretty straightforward.
It is.
To kind of gauge their mood.
Yeah, and if they answer several days or more to either one of those questions, it warrants a more in-depth evaluation.
Okay, and then what about the GDS?
The Geriatric Depression Scale, that's a bit more comprehensive.
Okay.
It dives a bit deeper. It's got 15 yes or no questions covering a range of those symptoms associated with depression.
Like what kinds of things?
So feelings of sadness, hopelessness, loss of interest, changes in appetite or sleep, and even thoughts of death or suicide.
Wow.
Oh, yeah, it provides a more detailed look at those symptoms, especially in older adults.
And it's especially helpful for those who might not express their feelings openly.
Exactly.
Or experience depression differently than younger adults.
Right, because remember, they might present with those physical symptoms instead of actually saying they feel sad or hopeless.
Right, we talked about that earlier. It's so important to keep in mind.
It is. Consider the whole person.
Okay, let's shift gears again and dive into the social assessment part.
Okay, yeah.
I'm really curious about how evaluating someone's social situation plays a role in this whole comprehensive assessment.
It's a vital part. You know, we're not just looking at organs and systems.
It's more than that.
It's about their life, their context, their support network. All of these things have a huge impact on their well-being.
So walk me through it. What are those key components of a social assessment?
So we start by understanding their cultural background, their beliefs, their values, their traditions.
Okay.
This helps us tailor our approach.
To fit them as an individual.
Exactly, to their specific needs.
It's about respecting who they are.
Absolutely. And then we look at their support system.
Okay.
Do they have family, friends, neighbors who can help? Are they involved in any community groups or social activities?
So we're trying to see how connected they are.
Exactly. And identify any gaps in that support network.
And then we need to think about their caregiver needs too.
Yes. Definitely.
Do they need help with daily tasks?
Right. If so, who's providing that care? Are they feeling overwhelmed or stressed?
We need to support the caregivers too.
Absolutely.
And their home environment. Is that safe?
Yes. Is it accessible? Are there any potential hazards, things that could increase their risk of falls?
So many things to think about.
Right. And then we consider their financial well-being.
Oh, right. Finances are huge.
They are. Can they afford their meds, food, necessities? Are they struggling?
Yeah, that stress can really impact their health.
Absolutely. And finally, we talk about those advance directives.
Okay.
Have they documented their wishes for medical care? End-of-life decisions.
It's about respecting their autonomy.
Exactly. Making sure their preferences are honored.
It sounds like this social assessment is so multifaceted.
It is.
It covers so many areas.
It highlights that health isn't just about the physical body. It's also social, emotional, environmental.
It all ties together.
It does.
You know, you mentioned that something as simple as asking about emergency contacts.
Yes.
Can actually reveal a lot about someone's social needs.
It might seem like a routine question, but it can tell us so much.
How so?
If someone struggles to name an emergency contact, or if their only contact lives far away, it could be a sign of social isolation.
Oh, I see.
Or a lack of support.
Looks like a little clue.
It is.
Okay, let's talk about functional assessment.
Right.
I talked about ADLs, activities of daily living.
Mm-hmm.
But I know there's also this category of instrumental activities of daily living, or IADLs.
Yes, IADLs, they're a bit more complex than those basic ADLs.
Okay.
They require higher level thinking and organizational skills.
Like what kinds of things?
So managing finances, shopping for groceries, preparing meals, using transportation, managing medications, and using a telephone.
So things that allow them to live independently?
Precisely.
Are there specific tools to evaluate IADLs?
Yes, various questionnaires and scales.
Okay.
Clinicians use a combination of self-reporting and observations to gather that information.
So similar to ADLs.
Exactly. And it's important to consider their context when interpreting those results.
What do you mean?
Well, someone who lives in a rural area might have a tough time accessing transportation.
Oh, right.
Which could make it hard to shop for groceries or get to appointments. It's not about their cognitive ability.
It's about their environment.
Exactly.
We have to look at the whole picture.
We do.
Now, you mentioned that just watching someone do simple tasks can reveal a lot about their functional status.
Absolutely. Can you give me some examples?
Of course. Imagine watching someone button their shirt or tie their shoes.
Yeah.
Are they struggling with coordination? Do they seem frustrated?
Okay.
It tells us about their dexterity and cognitive processing.
Or even just walking across the room.
Exactly. Are they steady? Do they need any help? Are they at risk of falling?
So those everyday movements tell us so much.
They do. And it's not just physical. Observe how they interact with you. Can they follow instructions? Do they seem confused?
It's also about their cognitive function and communication.
You got it.
Observation is really a powerful tool.
It is. It lets us gather information beyond what they tell us.
And that helps us paint a complete picture.
It's about those little things, those everyday actions and interactions.
Exactly. And that's key to geriatric assessment. It's not just about tests. It's about observing, listening, and understanding the whole person.
I like that.
And welcome back to our deep dive on geriatric assessment.
We've been exploring all these insights from the Orlev Center team.
It's amazing, isn't it?
It is. I mean, this is so valuable for anyone who's involved in caring for older adults.
Absolutely.
We've covered so much from the nuances of those assessments to social support. But I'm really intrigued by this focus on mobility.
Yeah, that's a big one.
It seems so fundamental to independence and well-being, especially as we age.
It really is, and it's often one of the first things to decline.
Oh, interesting.
Yeah, the Orlev Center team really emphasizes the importance of assessing walking speed. Oh. It's a powerful indicator of overall health and function.
Why is that? What makes walking speed so significant?
It reflects this complex interplay of physical, cognitive, and neurological factors.
Oh, wow.
It's like a window into their overall health.
I see.
A decline in walking speed can be a warning sign even before other symptoms show up.
So it's something to really pay attention to.
It is.
And the source material actually gives us specific thresholds, right?
Yeah. A walking speed of less than 0.8 meters per second is a red flag. It means we need to investigate further.
So what does that look like? What tools or techniques are used to evaluate gait and balance?
One that's commonly used is the timed up and go test. We talked about it earlier, but it's worth revisiting.
Okay, remind me.
So we observe how long it takes someone to stand up from a chair, walk a short distance, turn around, walk back, and sit down.
It sounds so simple.
It is, but the time it takes is a strong predictor of fall risk.
Really?
Yeah, and future functional decline.
That's incredible. Are there other assessments used?
Yeah, we observe their gait pattern, looking for any abnormalities like shuffling, swaying.
I see.
And we assess balance by observing how well they can stand in different positions.
So we're really looking at how they move.
We are, and these assessments help us pinpoint any underlying issues.
Things like muscle weakness, joint pain.
Exactly. Or neurological conditions, even medication side effects.
It's about getting to the root of the problem.
It is.
Now, what about falls? What are some key strategies for older adults to stay safe and mobile?
The Orlev Center team emphasizes a multifaceted approach to fall prevention.
Okay.
Exercise is key, especially focusing on strength, balance, and flexibility.
So it's not just about being active in general.
No, it's targeted.
What about things beyond exercise?
Medication review is important.
Yeah.
Some medications can actually increase the risk of falls.
Oh, interesting.
Yeah. So working with a healthcare provider to adjust those can make a big difference.
It's about looking at everything.
It is. And then there's the home environment. Simple things like removing tripping hazards, improving lighting, installing grab bars.
Making it safe.
Exactly. And footwear is huge.
Yeah.
Good support and non-slip soles are so important.
Those little details matter.
They do. And for those at higher risk, assistive devices like canes or walkers can help.
It's about finding the right combination of strategies.
Exactly. It's personalized.
This deep dive has been so